Welcome back to another special episode of Jail Psychologist. Today we're going to be talking about the Medicaid Inmate Exclusion Rule and how it ostensibly saves money, while in reality all it does is shift federal and state costs to local governments, makes treatment more expensive than it needs to be, and redistributes wealth from the average citizen to wealthy corporations. Let's start with explaining what Medicaid is. Medicaid is a government health insurance program that was created to help poor people access medical and mental health care. As of September 2025, there were about 77 million people enrolled in Medicaid. Now, Medicaid does two important things for the purposes of this discussion. First, and most obviously, it subsidizes the cost of care. Medical and mental health care are expensive, so these subsidies make care much more affordable. Second, and more important for our discussion today, Medicaid negotiates and sets rates for the provision of services and medications. I'll give a couple examples to help make this clear. I'm going to use rough estimates here for cost, but be mindful that costs are constantly shifting and differ depending on where you live and what treatment provider you have. So let's say you need an x-ray because maybe you broke a rib. If you have Medicaid, you could pay about $3 for this service, and Medicaid might pay another $20 to your provider for a total cost of $23 for the x-ray. Now let's say you don't have any insurance and you have to pay out of pocket. Now the x-ray could cost $200, almost 10 times as much, because you have to pay the full rate and not the Medicaid rate. Let's do a mental health example. Let's say you need a 30-day prescription of your ADHD medication. With Medicaid, you might pay $2 out of pocket, and Medicaid maybe pays another $5 to cover the cost of the medication for a total of $7. Now, what if you don't have insurance? The same 30-day prescription out of pocket is going to cost you around $40, or about 5 times as much. In both of these cases, the total amount paid for the service or medication is significantly less through Medicaid than it is out of pocket. Okay, so what is the Inmate Medicaid Exclusion Rule? This is a rule that says whenever a person who is on Medicaid is incarcerated in a jail or prison, their healthcare benefits are frozen until they get back out of jail or prison. In essence, even though the inmate has Medicaid at the time of their arrest, the jail medical staff are not allowed to bill Medicaid for any services they provide. For our purposes, the inmate is treated as if they don't have any health insurance at all. The Inmate Medicaid Exclusion Rule is a rule that has been on the books since Medicaid began in 1965. The logic at the time of its inception was that if a local government made the decision to arrest someone, then that government should be responsible for providing medical care. Now, this is fundamentally illogical when you consider that local governments don't really get to decide who to arrest or who not to arrest. Local governments have to enforce the laws that were created by their state governments. So here you see a mismatch between who created the laws, state and federal governments, and who is responsible for enforcing them, local governments. We talked about unfunded mandates in a previous episode. States telling local governments who they need to arrest and then failing to help pay for the care of those people is just another unfunded mandate by a different name. Now, a common reaction I hear when I explain this is, Will, you're just a bleeding heart who thinks that criminals should have free health care. Or, Will, you just want state governments to pay for a service so that your county doesn't have to. And neither of these is the case. Allow me to explain. First, inmates in jails are not all criminals. Most of them are pre-adjudicated, which means that the court has not yet decided if they're guilty or innocent. It strikes me as unfair that you would deny someone a service before knowing if they actually did anything wrong. And keep in mind that these people could be in jail for weeks or months waiting on the courts, and jails are constitutionally required to provide care throughout that duration. Second, there is no such thing as free healthcare. Medicaid is funded by taxpayer dollars. And you know what else is funded by taxpayer dollars? The healthcare we have to provide to people in jails. So if it's taxpayer funded either way, why does it matter? Well, remember what we said about the difference between how much Medicaid pays for treatment compared to how much you have to pay for treatment without insurance. Medicaid spends much less money on medications and services than those same medications and services cost on the open market. So what the Inmate Medicaid Exclusion Rule actually does is shift costs onto local governments while forcing them to pay 5 to 10 times more for the same care. And who benefits from this policy? Treatment providers to some extent, but the real winners here are the pharmacies and the drug companies. Because jails can't run costs through Medicaid, this means that jails have to pay full price for medications, some of which are extremely expensive. For example, HIV meds and long-acting antipsychotics routinely cost jails thousands of dollars per month per patient. You get one inmate in your jail who is on an exotic antipsychotic, and that one inmate just added $6,000 to the jail's monthly bill. You get one inmate on a brand name HIV medication, and you're looking at another $5,000 to this month's pharmacy bill. And guess what? Some inmates need to be on multiple medications. I've seen inmates on combinations of medications that cost their jail over $10,000 per month just for one inmate. Now, if that patient had Medicaid, his out-of-pocket costs would have been $10, and Medicaid itself would probably have paid $100 for all of these medications. By the way, the reason I can't give you exact dollar-for-dollar examples using real medications is that privacy laws make it impossible for me to figure out how much Medicaid pays for some of these otherwise expensive brand name medications. So anyway, because of the federal inmate exclusion rule, cities and counties end up paying significantly more for care than it would have cost the state or federal government to provide this same care in the community. Functionally and practically speaking, all this rule does is extract money from local taxpayers and turn it into a free handout for pharmacies and drug manufacturers. When local jails are barred from using negotiated rates, they are forced to purchase at monopoly retail prices, and the difference flows directly to the manufacturers. At that same time, these high costs strain local budgets and make it difficult or impossible to raise employee wages, fund infrastructure projects, or provide additional community services. So what should be done to fix this? You might be thinking that the solution is to just allow people to keep their Medicaid while they're incarcerated. And to be honest, that's the most practical and simple solution. However, as we have established in previous videos, state budgets are stretched due to unfunded mandates from the federal government, so they are going It keeps the responsibility for paying for care on the local government, while at the same time dramatically reducing their costs. And it actually produces a small but noticeable new revenue stream for state governments that does not require them to raise taxes. This would not incentivize overbilling because counties are still picking up the check, and all billing could still be subject to a Medicaid utilization review. So, that's what I have for you today. Now you know how the federal Medicaid exclusion rule is wasting your local tax dollars for no reason and what we can do to fix it. Any legislators out there who are interested in fixing this, feel free to reach out to me and I am happy to help you. That's all the time we have for our session today. I'll see you next week.